a lot of chiropractors didn't think they're that good at chiropractors, but it was just because they weren't measuring what they were doing. And
I know.
if you measure it, you're like, whoa, maybe I'm pretty good.
Yeah, and also knowing, but for me, what has changed a lot through the experience of now doing these tests for 5 years is also understanding the difference of results, and pre-framing that for the practice member. And yeah, we do a lot of SOT, we do a lot of BGI, so tonal technique. I do adjust a lot as well, but some people would say, what, you don't do manual adjustings? Like there can't be any change. And I'm like, oh, just let me
I'll
show
show
you the
you.
2,000 cases I have.
It gives you so much confidence. You're like, oh
It
yeah,
really does.
yeah, totally.
And it's just cool to see. I think in the end, if you do the technique you do on a very high skill level and with a good intention, you are going to create change in that nervous system, and that is going to create the changes. And it doesn't matter if you do a tonal technique or manual adjusting. Yeah.
Yeah, well, and again, especially the more we get into, well, the more I get into teaching technique, the more I'm really focusing on just paying attention to what is the outcome. What we want: decreased tone, we want cues of safety through the whole McDonald's safety corridor. And however you get there, it doesn't matter. And that's the creativity of a chiropractor, I find, is that then we get to use the skills that we've learned and the different tools that we have to get them there. And then we'll do it, and then use what we feel is going to help them get there. So I think that makes you more of a like an artist. That feels like an artist when you're as a chiropractor. So that's pretty cool. Knowing just learning a bit about the polyvagal theory too, just because you've come to a few of our seminars there in England, and you brought the new baby out to Dublin, and so tell me a little bit about your learnings from the polyvagal theory and some of the things that you've used from the polyvagal theory to implement in your life or practice.
So what I start with my personal, because I think once you are regulated, you can do it much better anyway. So I feel like with this whole, I'm not deep down in the theory of polyvagal. I have read a little bit around it, so I kind of know what's going on, I think. But for me, the biggest change is how do I feel safe? What is that feeling inside me? Like, how do I feel regulated? And generally understanding my feelings, like what do I feel now? And what is this appropriate? Or is there something I can be doing to help regulate myself again? I think that has made a massive difference in my personal life with the kids, with my husband, in business life, I have a few employees, not associates, but receptionists and tech CAs and whatever. And then also being a chiropractor, because only if you're regulated, there's only the space then that you can actually help somebody else to regulate and feel safe. And that can happen in 2 to 5 minutes. They don't have to lie there for 45 minutes or 30 minutes. And I don't need to massage their upper traps to achieve that. And yes, what I adjust, like when I see a patient, I watch out for very different things. Like you said, how does their face look? What is their language? Can they even communicate? Because that is one of my most favorite quotes, and I cannot quote it, but Brandy McDonald says it all the time. You can only really communicate when you're regulated, because communication is a skill that's absent when you're not regulated very well.
Yes.
So yeah, I just watched them. What person is this? What life history does it have? Like, what do they have? Do they want to open up, or do they not want to open up? Which both is completely fine for me, because I don't really need to hear what trauma happened to them, because you feel their spine, you check out the body, and you're like, yeah, okay, there's a lot of tension here, and I know how to release that, and I know your body's going to calm down. And the amount of time it happens that people fall asleep on my bench, like 2 weeks ago, there was somebody who was snoring really loudly, and I have an open adjusting room, and I thought I might have to wake him up because it got a bit too loud. Anyway, so and adjusting wise, I focus on a few different things, and I focus more on what I've been doing already anyway. Yep. So ribs I find super important. Occiput, something I never adjusted. Like 1.5 years ago, I never would adjust an occiput just because I couldn't. And then I went